listening to the myPET podcast, the show for pet lovers of Australia and around the world.
Hi, you're listening to the myPET podcast. I'm Ari, and as always, I'm with our resident vet, Dr. Glenn.
Hello.
So this is just general advice. For advice specific to your dog, take your dog to the vet. If you're watching this because your dog has been bitten by a snake or you think they could have been bitten by a snake, stop the video and go to the vet right now. Right now.
Absolutely.
Like, don't put on a new shirt. Go to the vet right now.
Yep.
And don't take the snake. Don't kill the snake. Don't go near the snake. Just go to the vet. The vet doesn't want your snake.
No.
Yeah?
Good advice.
Yeah, you don't want the snake?
No, don't want the snake.
Okay, good. Okay, good luck. Okay, bye. All right, now everybody else, hopefully you're just here watching this for future reference. Let's get some tips about some snake safety.
Yep.
From Dr. Glenn and what to do in the case of a snake bite. This is very relevant because I've made really good friends with my snake catchers this weekend.
Yep.
I had two lovely brown snakes start a maternity ward on my back patio.
Yes, there's lots of snakes around, unfortunately. They love the animals, but when snakes and dogs mix, it's not very good.
No, it's not.
Yep.
I'm not scared of snakes. I actually quite like them as well. I don't want them to bite my doggy.
No.
Unless you see your dog being bitten by a snake, how do you know? And everybody watching, Glenn is an expert at this, not just because he's a vet, but because your dog has been bitten how many times?
I think I've had 16 snake envenomations or snake bites in my house yard at home with two of my dogs. Epony I think she's up to 5 browns and 4 red bellies, and Foxy, who is no longer with us, had 4 browns and 2 or 3 red bellies. So yes, lots of snake bites at my place, unfortunately. And I'm in a semi-rural urban area practice, and I see a dozen or more snake bites every year, sort of spring, summer period, snake season. Yep.
Yeah. So how do you know that they've been bitten by a snake if you don't see it?
Symptoms vary, and symptom onset varies. Literally, Australia's got, I think, 6 or 8 of the most top 10 venomous snakes in the world. Certainly eastern browns, red belly blacks, taipans, tigers, small-eyed snakes. There's lots of venomous snakes out there. In general, we've got sort of brown snakes and black snakes, which have got different toxicities, but they're all variations on the same theme. Neurotoxins that cause paresis, paralysis, and neurological problems, cardiovascular toxicity, so acute heart problems and becoming bleeding disorders, red blood cells that blow up in the bloodstream, so they are destroying their own red blood cells within the bloodstream.
Wow.
And that cascades through to kidney problems, where the kidneys block up through the blood breakdown products.
Wow. And there's some that do both, right?
Some that do both, yeah.
Wow.
And it's dose related, and red bellies sort of slower to less likely and slower to cause the neurological problems, but probably cause more bleeding disorders.
Wow.
And knock the organ systems around more. So, vary of themes, but really, has my dog been bitten? Acute collapse, more so with browns and taipans, but sometimes very worryingly for the dog's health, they will recover from that, and people think that the dog's fine. It must have been a whip snake or a less venomous snake or didn't get much or something. Animals they'll collapse within 5, 10, 15 minutes of being bitten, and sometimes it's excitation and nearly seizures, and like colonic spasms, and can't stand up. But then 5 or 10 minutes later, they'll be up and about and clinically normal and recover, but they've got a fatal dose in the system. They've recovered from the acute neurological side of things, but they, within hours, become progressively paralysed and all the blood clotting stuff and all the other stuff as well. Recovery from a problem after a snake bite is critically bad because they've probably got a fatal dose.
Yeah.
Right through to, the same brown snake could cause increasing paralysis without any other symptoms, like 6 to 8 to 10 to 12 hours later. So there's been plenty of dogs that have been seen with a snake, in the afternoon, haven't shown any symptoms, dog goes to bed and owners wake up in the morning, the dog's paralysed.
Yeah,
The bleeding side of things, again, that's internally and externally, so it's a bit like rat bait toxicity, like they can bleed internally. Mm-hmm. So you've just got coughing from bleeding in the lungs or bleeding in the abdomen, heart troubles. I mean, if they're going to die within minutes, it's usually the acute cardiac toxin effect, which doesn't happen very often. Obviously, it's dose related. Sometimes it's just a single bite. The dog's running along on a walk and the snake's there and it's just a warning bite. If a dog's attacking the snake or if it's got the snake in the mouth, I mean, the snake's battling for its life, so it's going to repeatedly bite with maximum envenomation to try and get out of the situation.
Yeah.
So it's a wide range of symptoms, but the main thing is if you've got any doubt at all that your dog's been bitten by a snake, I would recommend attending your vet or an emergency vet, because we can do tests that give us a better idea of what's going on, and treating them before they show increasing symptoms is definitely the best chance of getting out of it with your wild intact, because the earlier you treat them, the less intensive you've got to treat them, because if they become paralysed, and that includes paralysis of the respiratory muscles. I mean, there's been plenty of dogs that have been on ventilators for 2 days, 3 days, 5 days, 10 days on artificial ventilation, which saves their life, but you've got a very large emergency and critical care, intensive care bill at the end of it.
I think that's something that a lot of people don't realise, is that you guys can test to see if they've been bitten and also what kind of anti-venom to use.
To a large extent, and it's complicated because, I mean, you can buy snake envenomation tests, which CSL makes. They're pretty accurate, but sometimes they don't come up on the test and they have been bitten because, again, okay, what's the toxin doing? Like it's the bite goes underneath the skin and the venom's underneath the skin. It then doesn't go via the bloodstream very often. It's mostly in the lymphatic system, so it's then absorbed. So if the dog's just been bitten and you do a snake envenomation test then, and urine is more accurate than a blood sample, and you can swab a bite site, but you next to never find a bite site on a dog. Like you can be convinced that the dog's been bitten by the brown snake and they've collapsed, but you can't find a bloody bite site on them anywhere. And you don't need to find a bite site, but absence of a bite site has got nothing to do with have them been bitten or not. But the test, it's pretty accurate. Probably more accurate is blood clotting times, and that can be dictated at the vet clinic and use that as a clinical indicator of, okay, have they got venom in the system or not? And it's also clinical signs. But sometimes it's complicated where you'll be presented with a pet that's got paralysis symptoms, and if you're in a snaky area, often you're in a paralysis tick area, and okay, you got a paralysed dog, is it a snake or is it a tick? So okay, we could still be both. We don't know that it's seen a snake, so it could still be both. We're trying to find a tick, can't find a tick. Okay, is that because we can't find a tick or because it was bitten by a snake? So then you do the clotting tests, and it's got an extended clotting time. Okay, it's more likely it's been bitten by a snake. But
so you definitely don't need to see the snake, and this is why they don't need to see the snake.
Don't need to see the snake.
Even if we don't dislike snakes, we just don't want the snake.
No. And yes, I've had dead snakes presented to me in shopping bags and Tupperware containers that definitely aren't dead. No. And people have picked them up and put them in a bag thinking that they were dead, and it's a live brown snake that could well have bitten them.
I know, so then you're going to have the dog at the vet and the people at the hospital. It's
correct.
Just a bad time.
No, don't do it.
It's a bad time. Just no.
But bottom line is there's tests that can give us good indicators that the pet's been envenomated, and nowadays we've got multivalent anti-venom, where you don't need to know what the type of snake is because the anti-venom treats for both browns and red bellies, so you don't need to know.
Lovely.
Yeah, well, both brown snakes and black type snakes. Yeah.
Thank you to science for developing that
Absolutely.
very handy tool.
And you still get just brown anti-venom, but it's usually cheaper to give the multivalent because there's a lot more of the anti-venom in it.
Yeah, cool.
Yep.
So what first aid can people do if they know that the dog has been bitten by a snake?
Yeah, if you see a dog with a snake, and you see the dog getting bitten by the snake, try and remove your dog as quickly as possible from that situation. Put your dog on a lead, keep them as calm as possible to be moving as little as possible, and put them in the car and get to your nearest vet. Ring your nearest vet if they need to be rung. But there's very little point in, because I mean most of the bites I see I think are probably around the face, because they're usually the dog's got the snake in its mouth, or it's trying to get the snake with its face, and the dog bites it on the face, and maybe it bites on the limbs. And I mean I've seen suspected snake bites on limbs, but by the time you try and put a effective compression bandage on the limb of a dog that's jumping around having been bitten by a snake, it's probably very ineffective anyway. I mean, dogs have got short limbs that are difficult to bandage and all the rest of it, so it's really just keep them as calm as possible, seek veterinary emergency attention as soon as possible.
And what do you do when your own dogs get bitten?
I keep them as calm as possible. I put them in the car, I take them to the vet clinic and start running tests on them.
And say not again?
I think I've done like 40 or more tests on my dogs to see if they've been bitten by snakes.
So many.
Because some dogs will go out of their way to hunt snakes, and that's the problem. Like, I mean, if you chance across a snake, that's bad luck. But some dogs are just bloody snake hunters, and all the bites at my place have been in my house yard, which is about an acre, my house yard, but it's got stables and horse feed and chickens adjacent to it and stuff. So there's plenty of food for snakes. But my two horrible snake killers, if there's a snake in the yard, they will eventually track it down and try and kill it, the little bastards.
I was so proud of my dog with my brown snakes. They're my snakes now, apparently. Because they had taken up residence in the rose bushes just beside my back patio and the path out of my back patio into my garden. And one was gone, so I thought, cool, no more snakes, and walked out there very confidently. And my dog actually noticed the snake before I did, and he stopped and he looked at me as if to say, there's danger. Like, yes. Danger Noodle. Like Danger Will Robinson. Very nerdy reference that no one's probably going to get.
But I mean, that's what your snake does. And ironically, a little scruffy Jack Russell, who are notorious hunters, he stands back and barks, whereas the silly Dalmatian blunders in and says, I'm going to deal with this situation. Yes.
Yes. So, treatment for snake bites. We talked a little bit about the anti-venom. What other sort of treatment happens?
I mean, there's aggressive intravenous fluids to treat vascular shock. There's medications to help counteract the effects of the toxin, and also counteract the likelihood of an adverse reaction to the anti-venom, which is pretty uncommon, but you're on cardiac monitors and pulse oxes and all the stuff that helps to keep them alive and not going into shock and all those sort of things. I mean, if you've got paralysis syndromes, I mean, there's a lot of nursing care for expressing bladders and keeping, all the body functions happening normally. I mean, sometimes they need ventilation, and it's usually only like larger vet clinics and specialist centres that can do that. And it's, it's a reasonably big task to go down that path. If you've got significant blood clotting problems, there's plasma, hyperimmune plasma that you can give the pets to stabilise their blood clotting parameters, because internal bleeding and that sort of thing, I mean, that's not cool. Aggressive intravenous fluid therapy to flush the kidneys out, because if sometimes you'll draw blood, and blood should be, when you spin it down, it'll settle out into the red blood cells and the clear serum. One of the quick tests you can do is spin that down if you've got hemolysis or red serum, so the red blood cells are breaking within the bloodstream, and sometimes that happens, but the blood clotting parameters are still normal, but the serum is showing signs of hemolysis, and it's those blood breakdown products that affect the kidneys, so you've got to flush that out of the system, basically. Intravenous vitamin C at high doses is not part of my routine therapy for snake bite and venomation. There's lots of wives' tale country people city people that give injections of vitamin C for dogs that are suspected of snake bite. Yes, and for its miraculous cure properties and antioxidant and all sorts of things that vitamin C gets used for.
I have not heard this.
It's not a known cure. Look, I've seen dogs that have been bitten by snakes that don't die. If you gave that dog vitamin C and it didn't die, it wasn't going to die anyway. It wasn't because of the vitamin C. If your vet chooses to give vitamin C at the same time as anti-venom, I've got no problems with that. But if you choose to give vitamin C instead of seeking veterinary therapy for your dog, and I know there's remote people out there and you're 400 kilometres from a vet and that sucks, and if you've got vitamin C, okay, maybe you're going to give it, but if you've got vitamin C instead of seeking appropriate veterinary care, which is a hell of a lot more likely to save a dog's life, that's my stance on vitamin C therapy.
Yeah.
Yes.
If your dog is a pirate and has scurvy,
yes,
maybe
potentially
some vitamin C.
But high dose all at once probably isn't going to cure your scurvy either.
No.
And just don't go there.
Yeah, no. And maybe try and talk to your dog about not pirating, because that's bad.
Correct.
Yeah.
Yep.
So there's ethical obligations there of pet owners to make sure their dogs don't become pirates.
Absolutely.
Now, you're probably not a very good person to ask this question to, because I don't think you're very good at this. Sorry, Glenn.
Preventing snake bites.
Snake bites. I'm better at that because clearly I just have a perfect dog.
Yes.
So,
first step, don't waste your money on snake repellent, ultrasonic, solar-powered snake repellent devices because they certainly don't work. There's no scientific evidence they work. And if you just Google photos of snakes lying curled up underneath snake repellent devices, that's a complete waste of time.
Yeah.
Save that money onto more effective fencing of your area to keep things that snakes like out, as in clear the yard of debris and piles of tin and places that rodents and snakes like to live. That would be a good idea. If you've got a chook yard, try and have as little mouse food out as possible. Use feeders that keeps the feet off the ground and do as many things to keep snake food sources away. And yes, the clearer your yard, which is easy for me to say, but I've got stables in the house yard and a horse feed shed in the yard and a hay shed and gardens everywhere with ground cover that all the snakes like.
Yeah, that was my problem too. And also
and that's not going to change.
Of all the rain, some of the back patio concrete like underneath that developed a nice hole that they decided would be a very good maternity ward.
And I mean, most of the time, if your yard is relatively clear, I mean, the snakes are just passing through.
Yeah.
I mean, my dogs aren't allowed unsupervised out in the house yard if we're not there. They get locked in the stables if we're not at home or in the house because they can't be trusted outside.
Yeah.
But it's really just, all you can do, as much as you can do in Australia with lots of venomous snakes, is have as little shelter for the snakes as possible and have as little food sources for the things that snakes eat as possible, and realistically that's all you can do, because you can't snake-proof your yard.
No.
You can. It is very difficult. There is wire mesh that's really fine that you can use to keep snakes out, but it's a very costly and large undertaking to do that.
Yes, I have considered just making like a dome out of that wire and moving into that.
Just over the whole house.
Making. But then knowing my luck, there'd be a snake inside.
That's right. There's one already in there, and then you're just keeping them in like a terrarium.
Yeah. They also like water apparently, and I had some pots of bromeliads and on the back patio, and the snake catcher said that the snake probably loved the water in my bromeliads.
Like the water and like the frogs that like being in the bromeliad flowers and all those things.
Yeah.
Yeah.
I read a funny story about a guy who I think it was in the early 1800s, who was from Ireland and had a snake problem when he'd come to Australia, and he ordered a whole boatload, like a whole big container of Irish soil to put down in his backyard.
Because there's no snakes in Ireland.
Yeah, and he thought that the Irish soil would deter the snakes.
That sounds like an Irishman joke.
I know. I read, apparently this guy did this. So, that's an interesting tactic. Okay. I don't know.
It's not top of my list on prevention for snakes.
No. I wouldn't. I think it's probably not the best idea.
Yeah.
It's probably a big waste of money.
Yeah.
It's not fun having snakes close by, but
But that's how you prevent it as much as possible, and if in doubt, go to your vet.
Yeah,
At
absolutely.
the end of the day. Yep.
Yeah, definitely. And good training helps as well.
Yes.
If you're near the dog and you can tell the dog, you can recall the dog, and they're not
Yes.
going to chase after it, then that's very helpful.
Yep.
If your dog listens to you.
There is snake aversion training.
Okay.
Ethically, I'm not sure where I stand on that because it's negative reinforcement.
Oh.
And I think there's lots of bad snake aversion training out there,
Right.
using shock collars and other things,
Oh, okay.
to try and convince this dog not to attack snakes.
Right.
And yeah, it happens. I think for every positive outcome from that, there's probably lots of negative outcomes.
Yep.
So I don't recommend that. But it's out there, and you see people doing snake aversion training, but the methods that are used most of the time are probably not in the best interest of the dog.
Yeah.
Yep.
Look, every time I have encountered a snake that I've seen before my dog did, I've called him back to me before he's even seen it. And I thought, I'm glad that he listened to me because he often doesn't.
Yeah. Look, a good general obedience training is always a good idea.
Yeah. Anyway, hopefully you never have to deal with your dog being bitten by a snake.
Yep.
And Murphy's Law says that now that you've watched this, you probably won't.
Yep.
But if you end up like Dr. Glenn and your dog gets a habit for it, you know what to do. So good luck. And
there's a very good chance that they'll be fine if you seek appropriate veterinary care early.
yeah.
Yep.
Yeah, wonderful. Well, take care.
Thanks, guys.
Thanks. Bye.